be given 20 seconds. First round, you will be given some clue and you will be given 20 seconds. And without any clue, if you answer it, then you will get 20 marks. But don't waste your time. So if you are not getting it, then ask for clue. If you answer it in one clue, then you are getting 15. If you are answering it with two clue, you are getting 10. And if you are answering it with three clue, you are getting 5. And if you cannot answer it, it will not pass to the other team but to the audience, who will give us the answer, and we have kept enough perks for audience also. Round 2 would be something different. If we are ready, we can go. Okay. Okay, round 2. Round 1 has started. Is it coming in the screen? Yes. I have named it as Who Am I? मैं कौन हूँ? अब है कि ये थोड़ा अटपटा है, तो पहला क्वेश्चन ऑडियंस को ही दे देते. As it is a अटपटा saying, Who am I? Audience, it is for you. Your time starts now. He won 1993 Nobel Prize in Chemistry. Audience, okay, tell me. Caribolis, excellent. This is for you. So this was the first clue that he got. Besides that, your time starts now. We see two things. Who am I? Your time already started. I think 2-3 seconds has left. Clue 1 is my brand name is excellent. So they got in one clue. So they got how many scorer? 15. So your concept is clear. So other clue were that their trade mirror, and it's a BLBI individual. So question, team 2, are you ready? Okay. Team 2, 1, 2, 3. I'm a molecule, and Drug Controller General of India recently approved me for MRSA infection. Who am I? Your time starts now. Clue 1. It's an indigenous Indian antibiotic. Second clue, I am known by the treatment name Amro. It was in the newspaper, but we don't need the trade name. We need the, your time is over. The third clue was it is produced by Walcott product. Audience. Sarji, Pranam. So exciting prize Asim Sarfaraz लेके आ रहे हैं. लेके भाग रहा हूँ सर. Team 3, are you ready? You already get the rule of the game, right? Team 3, who am I? I am a popular stewardship campaign in NHS hospital. I have been talked about in this conference. So who am I? Your time started. It's a stewardship campaign, it's a stewardship policy, it's a stewardship way of doing it. Clue 1. It was first proposed by AIIMS in 2011 and it is updated in 2015 for practical use. Okay, clue 3. Its approach is a clever starting of time off. Okay. Its approach is clever starting of antibiotic. Clever. The word is written in red. And then focusing on attention to the other aspect of stewardship. Audience, may I have the answer? Start smart and then focus. Sir ji, दूसरे sir को प्रणाम. And prize goes to Dr. Apurv Sastry. Now, who is it? Team number 4. Who am I? I am fill in the blank actually. I am dash stewardship. That is case-based education via prospective audit and feedback. It is actually fill in the blank. Who am I? Fill in the blank. Your time has started now.
Clue 1.
Clue 1 is it is about using antibiotic without any restriction and period.
Uncheck stewardship.
Yes, excellent. So you are getting the answer in with one clue, so you are getting 15 marks. So can you please hand over your mic to the next? We see a train. We see it is might be having someone that is having a bioterrorism potential. And had it been a Ifigua, then I would have asked you what is the name of the movie. Definitely not in a stewardship quiz. The movie is Krasanda Crossing, जिसके ऊपर हम लोगों ने बनाया था बर्निंग, जिसमें कोई बैक्टीरिया नहीं था, लेकिन इसमें एक बैक्टीरिया था, एक डिजीज था. So I will not name the Hindi movie that is being made on this CA. My question is, what is the microorganism referring to in this movie? Your time has started. Clue. Okay, so your clue 1 is that 65 to 67 इसके लिए gravity का discovery हुआ था क्योंकि कैम्ब्रिज बंद हो गए थे तो न्यूटन अप्पल के निसेस हो गए थे तो ग्रेविटी डिस्कवरी हो गए क्योंकि उस समय भी वही बीमारी चल रहा था. नेक्स्ट क्लू इज ओके एज नेक्स्ट क्लू इज एक बहुत ही बड़ा मूवी नॉवेल है जिसपे ये डिजीज है बट योर टाइम इज अप. इट इज फॉर द ऑडियंस. यस but you have to name the organism. So it's a gram-negative bacilli. So, and the movie was about plague and so this question is to Team 6. So we are coming to the end of round 1 and no one can blame us. There was an outbreak in South Brompton Hospital by this organism. You have to name the organism. Who am I?
Clue.
Clue 1 is it's an emerging pathogen in healthcare setting with a very notorious outbreak potential. You can ask. No. Emerging. What's a clue learner?
Clue.
It is difficult to identify in normal lab. Your time is up. Question again goes to. Okay, so one prize goes to. Yes. Your name, madam, please. Gayatri. So one prize, excellent prize for Gayatri also. So we have come to the end of round 1. So may I.
Thank you so much, sir. So we had a lot of fun in the first round. Now we entered a little bit of gravity in the second round, but not much, nothing to get worried about. So the second round is all about visual questions. Alright, so we will show a visual to you. There will be 2 parts of that visual question. Alright, we'll just run through the rules what you have to do. So each question will have 2 parts, and say for example, team A gets that visual question. Alright, so each part of the question carries 10 marks. Alright, now by some chance team A is not able to answer. It becomes a passable question and it passes to the next team. So when it passes to the next team, obviously the total number of marks is halved, right? So the team which actually gets a question will have a total 20-mark question with 10 marks for one part and 10 marks for the other part. When it gets passed, it will become a 10-mark question with 5 marks for the first part and 5 marks for the second part. Alright? and it's all visual questions. Alright, shall we go ahead? Ready everyone? Alright. So this is the question for the first team, team 1. So there is a visual on the screen. This is what you have to do. You have to identify this visual and interpret it. Your time has started. So have a look at the visual, see what is there in the x-axis and the y-axis. Something is plotted. It is something which was
therapeutic drug molecule.
Can you be a little bit, I want a more specific answer. It is something with, okay. It passes to the next team. So it is plotting something, isn't it? It is plotting something, a concentration versus a time between start of infusion and drawing of sample. The next team. Anyone else? Do you know the answer?
It's about sending the sample for therapeutic drug monitoring.
Not exactly. No. Team 6. Alright. So then we'll go to the answer of this one. Does anyone in the audience wants to guess what this is about? Residence. Right. Little tough maybe? Okay. So let us go to the answers. Alright. So that's the answer. Actually, that was a Hartford nomogram. So throughout all the talks that we had, we were talking about therapeutic drug monitoring in a way, pharmacokinetics in a way, but to be more specific, that is a Hartford nomogram. Alright. So what that nomogram indicates is, so see, how do you prescribe, dose aminoglycosides, right? So there are two ways of dosing aminoglycosides. Either you can have a very low dose and a frequent dosing, or you can have a very high dose and an extended frequent dosing. So that Hartford nomogram was depicting the extended and frequency high dose dosing of aminoglycoside. I'll just briefly tell you also, I think I'll take a minute, I hope no one minds, because since no one answered, I would really like to tell you a minute about it. So usually, we would give aminoglycoside started as 1 to 2 milligram per kg dose, right, and give frequent doses. But then you can also do a high dose and extended frequency dosing of aminoglycoside, where you give it at a very higher dose, like 5 milligram per kg or 7 milligram per kg. So this Hartford nomogram is used when you are dosing it at 7 milligram per kg. So what you do is you give the patient a starting 7 milligram per kg, and then around 10 to 12 hours later, you take a sample and see what is the concentration of the aminoglycoside. Alright, and then you plot it in the nomogram and you see in which quartile does it come in. It does it come in Q24H or 36 hours or 48 hours. So depending upon that, you will decide when you will give the next regimen. Alright, say for example the concentration falls in 36 hours. That means the next regimen you will give 36 hours later. That is this Hartford nomogram. Alright, fine. So we'll go to the next question for team 2. This is your visual. And this is your question.
Triphasic elimination. What?
Sorry, can you repeat this?
This is representing elimination kinetics, ma'am.
Alright, good. Anything else that you want to say? A little bit more specific and interpret. Passes to the next team.
Post-antibiotic.
No, sorry. Team 4.
First order elimination is occurring by redistribution and actually followed by zero order elimination.
Can you tell me the name of this model? Somewhere you are right. Can you name the model? Passes to the next team. The question is identify and interpret. Pass. Team 6.
Pharmacokinetic exchange model.
Everyone is giving partial answers. Identify and interpret. Alright, we'll go to the answer. So this is actually a two-compartment model that we use in pharmacokinetics. Actually, it is a very common model. You would have seen it in a lot of books. And I was expecting more answers in this. So what happens in a two-compartment model is there are some antibiotics. You give an IV bolus dose, and then initially they perfuse very quickly into certain tissues, which have a very high blood supply. And from them they diffuse slowly into the plasma, and then they are slowly excreted. So that is a two-compartment model, right? Very good. And many of you are nodding your heads when I am explaining. That means you knew the answer, right? No worries. Let's hope that the next question is easier. Alright, so this is the question for team 3. You have to identify the mechanism of resistance and suggest which antibiotic can be used to treat a patient with this kind of resistance pattern. And preferably quote an antibiotic which is in the latest guidelines.
Carbapenemase resistance.
Specific answer? Pass to team 4. Yes. I'm not able to switch on your mic and answer.
Metallo-beta-lactamase.
Excellent, excellent. Can you answer the second part of the question? Answer the second part of the question.
Cholesterol.
Latest.
Tetracycline.
Anything else? Latest guidelines. Can you pass the
EDTA meropenem.
Okay, the second part of the question is passing to team 5.
We can use BLB ELISA. Combination of BLB.
No. Passes to team 6.
Ticagrelor.
Passes to team 1. Sorry? Excellent. Sulfadenicol. Excellent. Anything else that you can tell Akshata besides sulfadenicol? Excellent. Excellent. So part of the question, marks go to team 4 and the rest to team 1. It is a pass question. 5-5. Exactly. 5-5. Excellent. Very good. This is the next question. To team 4. So you have 4 pictures, and with these 4 pictures, you have to identify the causative organism and mention its treatment. It's like giving a word clue, right? So you have 4 different pictures, you have to match it together, and yes?
Burkholderia sepacia.
Very good.
Onion for sepacia.
Yes, that's an onion bulb rot. Excellent.
And it will cause rapidly progressive pulmonary disease.
Yes.
Infiltration in chest
Including
X-ray.
a valve. Very good. That is a selective media. Now answer the second part. Treatment.
Ceftazidime.
Meropenem. Very good. Excellent. Very good. Very good. So it was a direct question. They've answered both parts. Very good. Team 5. So what is shown on the screen is a formula, and the clue to the formula also lies in the picture there. So you have to just identify the formula and tell me what it is used for. Your time starts now. Yes. Switch it on.
Put it for GFR.
Okay, identify the formula and what is it used for. Specific questions, I need specific answers, right?
The glomerular filtration rate, the constant.
Passes to team 6.
Creatinine clearance,
Creatinine.
weight, and used for the toxicity of drug, monitoring of toxicity of drug.
Can you give me the correct name of the formula? You are right with one part of it, but can you give me the name? Passes to team 1. In the mic, please. In the mic, please. Cockcroft and Gault formula. This is used for measuring creatinine clearance to dose antibiotics in renal impaired patients. Excellent. So, 5-5. Team 6 and Team 1. Team 1 gave the name, Team 6 gave the use. The question was for actually Team 5. So 5 and 5 for Team 6 and Team 1. Pass. And the question for Team 6. So connect the pictures and you tell me the name of the recent antibiotic that is approved in the use of this treatment and a non-antimicrobial therapy that you can use in recurrent severe cases. Mind you, this is a question again with relation to AMSP, so keep that in mind also. It's an indicator condition which is often looked for.
Clostridium difficile.
Yeah, but what is the answer for the two questions there? The question is not the name of the organism. Come on.
Non-antibiotic therapy is frequent washing and non-antibiotic.
Non-antimicrobial therapy.
Yes, frequent hand washing before and the isolation of the patient.
The question was the team 1, that's wrong. Yeah.
The non-antimicrobial therapy used is Bezilotoxumab and Actoxumab.
Okay. Anything else that you think of there?
Fidaxomycin.
Don't. First answer fidaxomycin. Second, nothing.
Fecal microbiome. Fecal microbiome.
Excellent. You have answered both parts. So 4. Yeah, in a pass. 5 plus 5 you get 10. Excellent round. So keep up your good work. Now I hand for the next round to Dr. Asim Sarfaraz. All the best.
So now we move on to the final round, the third round, that will possibly decide the winner. So best of luck all the teams. And we'll follow more or less a similar pattern where there will be some pictures and some will be also direct questions also. So quickly I'll explain the rules. So 10 seconds for each question and direct question if somebody is answering, that team will get 10 marks. If it is passing on to the next team, 5 seconds for the answer and 5 marks. So questions will go to audience if no one answers. So, move ahead. Okay. So, among the various metrics that are present for measuring antibiotic use, one does not consider the number of antibiotics the patient is on. Because normally when we are measuring the ultimate use, we also take into consideration the number of antibiotics that patient would have, 1, 2 or 3. For team 6. Team 6 will be answering this question. So, your time starts now. Passing to 5. Pass.
Days of therapy.
Sorry. Next.
LOT.
Very good. Can you elaborate? Two.
DDT and PDT.
Hey, you told the right
No,
answer.
what do you
Full
want?
form.
Different. LOT.
Full form of LOT.
You will get the mark.
Don't worry, it's a good answer. So
You will get
I think
the
we
mark,
can.
but the audience can take the expansion difference between
DOT and LOT. Okay, the answer was LOT, and as already told that we don't consider the number of this thing in this.
next question goes to
Team 5. So we can see 3 pictures over here. Alright, there are 2 drugs and a system over here. So the question for you is, Explain the drug interaction.
Cytochrome 3A4 microsomal enzyme inducer.
What will happen? So we can see three pictures over here. Alright, there are two drugs and a system over here. So the question for you is, explain the drug interaction.
The effective bioavailability in the blood will decrease.
What will be the action?
It will not be effective.
Effective in the sense,
The drug
Partly
effect
right.
will not be.
You are partly right, so you will be given. You were right. So you will be given 10 marks. In 5.
So actually itraconazole, as you correctly told, will lead to an enzyme enhancement, and that will actually affect the level of atorvastatin, and it will increase its plasma concentration rather than increasing complication. It is just
Partially correct, and that is why we have decided to leave the next question is for team 4. That is some
again we are going back to anatomy. Alright, so these are some pictures that you can see of a vital organ present in the neck region. So the question is that it produces the peptide. This peptide is used as a marker for initiation, de-escalation of antibiotic therapy. Can you? Very good. So you get 10 marks.
10 marks again to team
4.
10 marks again for team 4.
So we all know that it is commonly used as a biomarker for infectious disease, alright, and it is produced by the parafollicular cells of thyroid gland, and it was a biomarker for sepsis. Next question is to team 3.
Sir, we have direct question carries 20 marks.
Jumbled words. So can you unscramble the word and give the right answer? Time starts. Please pass. Team 1, please.
Pareto chart.
Very good. So I thought that this was a pretty much easy question. The answer was also there. You can see that both bar diagram and line diagram are there. Bar chart, line diagram. This is basically used when there are more than one variables involved and we want to see that what is the outcome. So very correct answer it is. A Pareto chart. Alright. Question for team 2. Again we can see that there is a picture, alright, and this is based on a system where a home-based antibiotic therapy can be given. Team 6.
Mike to team 6.
Mike to team 6.
Maharashtra.
Not the state. The plan. The question passes to team 5.
What is the name of the state?
Name the plan. You can see the state is in 2 pictures. Try to find how to link it.
Kerala strategic action plan. Kerala strategic action plan for One Health.
Okay, but you have got it, but it's not the right answer. You're near to that.
Kerala action plan for antimicrobial resistance.
What is the abbreviation?
Short form.
Capen.
No. Team 3.
What is the abbreviation?
Team 2. We have chance to come to government. Other like this.
Sir, Kerala antibiotic resistant.
Abbreviation.
All half answers are coming, we want the exact answer. So they will not get any marks, but they can get answer.
Audience.
No. Anybody from the audience?
Carsnet.
No, sir. Carsnet. Very good. It's actually CASA. And they have actually integrated both the global action plan, national action plan for this One Health initiative, so that all the what was being discussed, like human, animals, and environmental sources, all these things can be put in the single plan itself. So very good answer. So that with this.
This time, sorry to the audience, we got so busy with other things that we could not type out a question for the audience. So let's us have the winner. May I?
So the winner is Jipmer at 55 points. Second is AIIMS at 40 points. It's a tie between PGI and AIIMS Delhi at 10 points. And Patna is at 5 points and BHU at 0.
Okay. So we had in morning round, we had a elimination round. So we will first now go through the marks, and whoever had a better mark will be judges. May I have the scorecard, please? Because it will be time saving. May I have the scorecard for the morning, please? AIIMS Delhi and PGI. So we had an exciting round. I hope you also enjoyed, besides being in a competition, the spirit of participation through knowledge sharing, all of you have enjoyed. I hope audience have also enjoyed it as a show. So may I have a big round of applause for all the contestants. Contestant can now offload so that we can proceed to the next MCQ. And it was seen that AIIMS Delhi has more mark, 5 marks more than PGI. So the third winner is AIIMS Delhi. But yes, PGI, hats off for you also for being resilient, and so congratulations to you also. So third prize goes to AIIMS Delhi.